oversee us and help us to do the county's work, and please bless all the workers in the health department. Guide us and direct us as we go forth to do all in your good. In Jesus' name we pray. Amen.
Amen. Okay, face the flag, salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right, thank you, everyone. Any announcements this evening from our health director? I'm sorry.
Oh, you're good. The only announcement I have is we have started the community health assessment process. So the surveys are out in the community until September the 30th, and we'll be collecting data the 1st of October. So we'll be seeing that out, and please encourage people to take that.
All right. With that, is there any amendments to our agenda this evening?
There is, we're going to delete item 6. We have no new employees to introduce. And then also item 8, Dr. Wilson will be taking her oath next week, so we're going to out. And then on item 13, there at the bottom, we have a clinical update on Bill Schultz, who's going to be doing that update.
All right. All right, all those notations are made. Do I hear a motion that we adopt this evening's agenda?
So moved.
Second.
And a second. Thank you. All in favor say aye.
Aye.
Any opposed? And that motion carries unanimously. And that leads us to the first order of business this evening, which is election of officers. We do this annually, and it's come that time for the election of officers. So I'll turn that over to our health director, Miss Anna Cook, and allow her to conduct the election of officers for chair or vice chair.
I would like to open the floor for nominations for Board of Health Chair and or Vice Chair.
I'll nominate Randy for the chairman
Any other nominations?
and Wayne Rash for vice chair.
There you go.
I'll close the floor. All those in favor say aye.
Aye.
Opposed, like sign.
Okay. Well, I appreciate the confidence again and being the chair, and so I appreciate everyone and all that you do for the Board of Health and our health department and the personnel too. So next is our approval of the minutes from our June 5th meeting, and I trust you've had an opportunity to look at those. And if you have, do I hear a motion that we adopt them this evening?
So moved.
Second.
All right. Any other comment or discussion? All in favor say aye. Aye. Any opposed? And that motion carries unanimously. And then we have some financial reports this evening by Miss Brittany Raby. And the first of those looks like our budget summary for the fiscal year 24-25 as she comes to the podium. So.
Okay, so the first thing we'll talk about is the budget summary. This is month ending in June. So we expended 79% of our budget, and we brought in 81% of revenue, and then also 74% of county revenue as well. So that is month ending in June. We still have a 13th month in the county world, so I've kind of wrapped all that up, so you'll get that on your next Board of Health agendas and packets there. So I just kind of wanted, the next thing is a fiscal year 24-25 budget. So this just kind of wraps everything up except for that 13th month. So this breaks down all the line items within the departments. And so I hope that you've had a chance to kind of review that. But on here we've expended as a whole 77% of the budget. And then of course the revenue is 64%. And then the county revenue by source at 89%. So, and I've just attached all the departments there. So, if you have any questions, I'll be glad to answer those.
Do we need to take action on any of that?
Yes.
We do. All right. So you want us to take action on the budget summary for 24-25?
Yes.
Okay. So having the summary presented, do I have any Questions about the summary? And if not, do I hear a motion that we approve the budget summary as presented this evening?
I move that we approve the budget summary as presented.
All right.
I'll second it.
Second it.
Any other discussion or comment? All in favor say aye. Aye. Any opposed? And that motion carries unanimously. And then fiscal year 25-26 update.
Yeah, so the only thing with the 25-26 update, you will have the approved budget that was passed based on you guys' recommendations as well as what the commissioners have approved. So that is our budget for this fiscal year. So no changes there. Just want to kind of bring that to your attention so you have a copy of the approved budget. And then we also have some things that have been added to the budget and need approval on budget revisions, so.
All right, so those budget revisions, I think we have copies of that.
You do, you'll find, there was two that were in your packet. A lot of, most of these are from rollover funds that we got from the state. We kind of got those after the packets and things are mailed out. So the first one there is 117, that's our admin retention grant. That's funding, that is a 5-year grant, and that is the 80,462 is what we have left of that, and that goes for 5 years. They just send us an updated AA each year with the funds that we haven't expended. So we have 170, the retention, and then there is the breastfeeding peer counselor, grant 415. That is, that AA always comes later after we've done the budget. And so that's for $29,869, and that covers our breastfeeding peer counselor salary that comes in. At your seat, you have found 3 more revisions. I'm sorry.
Yep.
These all came in at the last minute here. So again, these are rollover funds that we got for each year. So 121 was ARPA funds that we got, $37,692. And then we also got Helene funds. The Helene funds, I'm pretty sure Anna's 8 years, right, on that one. So that one will continually, as long as we don't spend it, then we'll continue to have that every year up until that grant lapses. And then our communicable disease pandemic recovery, again, that's another one. That's a COVID rollover. So that one's $55,213. So you had 2 in your packet, and the 3 are new additional ones that came in after.
All right, so 5 budget revisions presented this evening. Do we have any questions about those? And if not, do I hear a motion that we adopt the budget revisions as has been presented?
I make a motion, we adopt them.
Second.
All right, a motion and a second. And again, any other discussion? All in favor say aye. Aye. Any opposed? And that motion carries as well.
Thank you.
All right, thank you, Brittany. And next, we have Miss Lisa Klontz with us this evening, and she's here to make a presentation about Caldwell County Shelter Home Collaboration. So, Lisa, if you'll come up. Welcome.
Good evening. Thank you so much for asking me to come in. I appreciate it. Just to update everyone as to where the shelter home of Caldwell County currently stands today. We are currently doing business as Shelter Home of the Foothills as of September 1, 2024, due to the additional coverage area of taking in the Catawba County area for domestic violence, sexual violence, and human trafficking. As we continue to grow our organization, one of the things that we continue to look at is what are our deficiencies and how can we better serve our community. And one of the things that continue to pop up in our minds and inside our campus was that of our response to rape and sexual assault victims within our community. And as we know, right now, the way it currently stands, in Alexander, Caldwell, and Catawba County, we work with 4 different emergency departments. We work with UNC Healthcare here in Caldwell. We work with Statesville, or Ardle Memorial. We work with Fry Regional Hospital. We work with Catawba Memorial Hospital. And those 4 emergency departments, annually, they see approximately 175,000 patients a year. And we all know that emergency departments means emergency department. Life-saving situations where patients or individuals in our community can go to seek support and medical attention. And as we look at a rape and a sexual assault victim, that may not always be prioritized at a very high level in our emergency departments, and rightfully so. So as we saw that, and we looked at a situation where we had two young rape victims that waited in a local emergency department in excess of 8 hours for a forensic examination, we knew then we had to do something. So we started the process of the Plum Blossom Project. And the Plum Blossom Project is a project that will take place on the shelter home of the Foothills Caldwell Emergency Shelter Campus. We've been very blessed in this community. Blue Ridge Energy Foundation provided us with $10,000 several months ago just simply to prepare the space. We have now renovated that space. We have a beautiful waiting room, an examination room, complete with bathroom and shower for our rape victims. We have created a multidisciplinary team, which Anna and her team are a part of, in our first meeting to develop our protocol, i.e. how each person is to respond in all rape and sexual assault situations so everyone knows their part in the plan, is scheduled for August the 19th. We have memorandums of understanding with all local law enforcement agencies within our Tri-County service area, also with our local health department, prosecution offices, both district attorney's offices, since they're in two different judicial districts, Alexander being one of their own with Iredell County, and then Caldwell and Catawba being in the same judicial district. So we have also received supportive funding to purchase the Cortex camera system, which, if any of you are familiar with evidentiary examinations, Robin's Nest, for example, has this camera system. This camera system costs in excess of $21,000, but it's very critical. And it's actually life-changing in the investigation of a rape and a sexual assault. Bernhardt Family Foundation and Coffee Foundation has graciously already donated money for our organization to purchase the Cortex camera system. I'm just simply waiting till a closer date when we know we're going to open to victim response to order that camera and get it in-house and so forth. So where do we go from here? We've been very blessed with funding. I can tell you, Sandra, if you were to walk in our examination room right now, you would see probably every kind of medical supply you can even imagine. We have the examination table. We have purchased all the equipment. We received some sexual assault funding through FIPSA, which is a family violence state-level funding. And at one time and in 1 month, I was allowed to purchase in excess of $21,000 worth of medical supplies to equip our examination room to start beginning service of victims. So as we continue to develop our protocol, our goal right now that we have set for ourselves is to serve our first victim by January 1. I will tell you, I think we're on fast track for that, Anna, and I think we'll serve our first victim prior to that. We already have contracted with a SANE personnel, that is a sexual assault nurse examiner. And Sandra can probably talk more to that if anyone has any questions, but that is a registered nurse that has attended the sexual assault nurse examiner certification class, and is that's both my understanding, Sandra, is both text and it's also clinical, where they are actually trained and certified to do the rape and sexual assault exams, where there's no physician actually required unless there's significant trauma or something like that, and at which time we would resource that individual to an emergency department. We would not complete that examination. But our organization already has SANE personnel contracted to perform those examinations, and we also have 2 licensed clinicians already contracted to work with the project to respond to clinical-based therapy and or counseling. So where does the Caldwell County Health Department come into this plan? They come into this plan through a memorandum of understanding that Anna and I created. But the response that I asked Anna for with she and her team was to be able to assist us with the aftermath somewhat of the rape and sexual assault, such as the sexual assault transmitted disease testing, the morning after considerations that women sometimes have to make a decision on, and those kind of things. So that's the partnership and the memorandum of understanding that the Shelter Home of the Foothills has with the Caldwell County Health Department. So we're very excited about this plan and this project. I have submitted another rather large grant application with the Department of Justice. That funding begins October 1. I'm in the portal every day to see if they've moved my application further into the process other than submitted, and they have not as of yet. So don't know if we'll receive that funding or not, but we have already communicated and partnered with North Carolina Victims Compensation through the Rape Victim Assistance Program. The Rape Victim Assistance Program is made for those rape and sexual assault victims that, as a result of a rape and a sexual assault, there is no cost to you as a victim. So the Rape Victim Assistance Program will reimburse our organization the $650 that we will pay the SANE personnel for each examination. So that, as I told my board, that'll be a wash. I will pay the SANE personnel, then they will in turn reimburse me for that. And they will also provide our organization with $500 medical facility per examination that we will turn right around and feed back into the project to continue it, to continue to serve victims in Alexander, Caldwell, and Catawba County that fall victims of sexual violence.
All right. Any questions, Ms. Clarence?
About how many do you think you're going to have utilizing the facility? I know you can't.
How many examinations that we'll do? Based on the current numerics, I have averaged about 15 to 20 per month in the 3 county areas. Now, we will just be doing the adults 18 and above. Robin's Nest will continue to do the children. We will not have anything to do with that. We're just going to be focusing on the adults.
Thank you for all you do.
Thank you. And we also have memorandums of understanding with all of our prisons. So we will be responding to PREA, the Prison Rape Elimination Act. So if we have an inmate either in one of those counties or Wilkes County, because we do cover the PREA in Wilkes County as well, they will be treated through the Plum Blossom Project as well.
All right. Thank you, Lisa.
Thank you.
That brings us to our public health updates, and Ms. Chelsea Parnell. Immunization update and clinical update. How's that? We'll just get them both with you.
Yeah, she dumped that on me. It's gonna be it's gonna be flipped a little bit. I'm gonna do her stuff first and then mine. But she wanted me to talk about some Athena updates. We're currently awaiting some updates regarding the state required monthly batch that's necessary for reporting, and then obviously the adjustments to the sliding scale fee. But in the interim, they have agreed to credit our account because right now we're paying for 2 EMR systems, CureMD currently, to still submit the monthly batch report to the state. Athena has agreed to credit our Athena account the amount we're paying for Cure each month, which is, thank you, there's a $1,842, which was nice to see that they're trying to work with us, because we do all really like Athena. Dr. McBurney can touch on that because he knows how great it is.
Oh, absolutely.
It's great on nursing side, clinical side. It's just they've never had to work with a health department, and we're very picky and because we have to do what the state says, obviously. A CCPN update, she wanted me to say that we've received or awarded an innovative funding grant, which we're going to utilize to acquire a hemoglobin A1C in-house testing machine. This equipment will enable us to deliver results to patients within 6 minutes during their actual office visit. And with that, we'll be able to meet Medicaid quality measures. So that will help with that. Another CCPN is our nurses have diligently engaged in outreach efforts to contact our Medicaid patients. Encourage them to attend services related to cervical cancer screening, STD testing, and annual wellness checks, immunizations, for Medicaid quality measures. For the month of July, over 300 phone calls were made by our clinic nurses, resulting in approximately 35 pap smear results being printed or found in like other Epic, other offices. It sounds kind of silly, but only 6 of them out of the 200 made appointments. It was a lot of effort, not a lot of fruit was given back to us, but we were able to make a lot of referrals to CCPN to do case management on those patients we weren't able to get a hold of. A lot of wrong phone numbers, not our counties, that they don't even live close by. So a lot of them were unreachable. So that's why we had to send a lot of letters out and referrals to the case management side. For CMARC, she wanted me to say, effective December 1st of this year, 2025, Healthy Blue Care Together will assume responsibility for case management of children in foster care, resulting in the transfer of 9 children from our CMARC program, which currently serves a total of 90. And then for immunizations, it's the Immunization Awareness Month. So as the academic year begins, I always encourage, we've been putting it out about kindergarten, 7th grade, and 12th grade need to have an updated immunization for the year. And then we've also been posting about, I'll go out to employee or offices to do flu clinics. As of right today, I've had 4 scheduled. So last year I think I did 12 to 15 businesses, I feel like, which is that a lot of people were really happy for me to come out and do that. A brief COVID update. We barely got some yesterday. Still some things being passed, but what we're thinking that for the COVID this year, it's only going to be recommended for 65 and up. And then from 12 to 64, if you have any comorbidities, that puts you at risk of COVID-19. The state has officially said we are not required to carry any VFC, which is vaccines for children for COVID. So, still things being passed, but that's all I have.
All right. Any questions for Chelsea?
I do want to send a comment out for her and Jill and Brittany. I know it's been a lot going on with Athena, and there for a brief second we thought about just saying, this is not working out for us. And it's not the work on both ends. It was just trying to figure out how to make Athena work with health departments. Because like she mentioned, there's a lot of things we have to do for the state, which is a lot of red tape and things that Athena's never even seen before, especially the reporting that we have to do. But I have full confidence in Athena will pull through, and these ladies have really worked hard getting where they're at right now. And also wanted to mention with CMARC and CMHARP with the case management, that's something that you may hear more about next year. I know she mentioned with the Blue Cross taking those patients on, that's already December, but if I'm not mistaken, they're in the works of still looking at this case management team to go to our PHPs, which is the primary health provider. If I got that right. So if that's the case, we will lose all those cases of children that we follow. And piggybacking on that is more of, we need to be thinking too about Medicaid. We don't really know what's going to be happening with that with the health department side, but just a heads up on that. You may see emails or things that I send out, that's new releases. I haven't heard anything in a while, maybe a month or so. I've been trying to be on those calls, but they're very particular of what they say. And all the questions is like, what's
Very
going on
vague.
now? And they will not say anything. So just a heads up with that and figuring out what we need to do in our next steps. Thank you, Chelsea.
All right, thank you.
You're welcome.
Has anybody else got anything for the good of the group this evening? If not, do I hear a motion that we adjourn?
Second.
All in favor, say aye.
Aye.
Aye, we are adjourned. Thank you again for being here, and have a good evening.